A few of you have been asking me to make a video about heart failure. It's actually a topic that is close to my own heart, as I've spent much of the last decade as a research physician looking after patients with chronic heart failure. My aim is to give you a broad overview on how and why heart failure happens, as well as some of the latest treatments. I'll try to include some of my tips that I've learned along the way from both clinicians and sometimes the patients themselves. What is heart failure? As I'm sure you already know, the heart is a pump which pushes and pulls blood around the body. In heart failure, the pump does not work as well as it should and usually gives people significant symptoms. This happens because of a number of causes, which I'll talk about soon. Roughly, there are two types of heart failure, and this matters in terms of what treatments can be used. Firstly, there is heart failure with reduced ejection fraction, which tends to affect men who have underlying coronary artery disease. Secondly, there is heart failure with preserved ejection fraction, which tends to affect older people, women, and those who are obese. Ejection fraction simply means the percentage of blood that is pumped out of the heart with each heartbeat. If it's less than 50%, it is reduced ejection fraction, and if it is more than 50%, it is preserved ejection fraction heart failure. What are the symptoms of heart failure? Breathlessness, or the more technical term, dyspnoea. This is most obvious at night time, where you may notice that you can't lie flat, or you have to sleep in a chair, or suddenly need to sit up to get your breath. The medical term for breathlessness when lying flat is called orthopnea. Also, it's really common that people notice they can't walk as far as they used to without feeling very breathless. For example, they used to be able to play a normal round of golf, but now they struggle with the first hole or walking 10 meters. Sometimes you'll see the acronym SOBOE in medical records, which means shortness of breath on exertion. Fluid. Classically, people notice fluid around their feet, ankles, and legs. The medical term is pitting edema, which means if you push with your finger, it leaves an indent. It tends to build up over the day and is better in the morning. For men, it's really typical to have fluid build up all around the tummy as well, where you can't get your belt closed and you can't blame it on eating too much. Tiredness. Heart failure is exhausting and every activity feels like such an effort to complete, like having a shower or making the bed. It's common for people to lose their appetite with more severe heart failure as well. What causes heart failure? Heart failure can either start suddenly, which is called acute heart failure, or gradually, chronic heart failure. In general, there are 7 major culprits that all put stress on the heart, but I'll list other causes in the description for you as well. Number 1, high blood pressure. If blood is going through the heart under very high pressure, the heart muscle gets bigger to deal with it, but will eventually give up the go if it's too much. Number 2, coronary artery disease. This affects the health of the walls of the heart. Number 3, heart valve diseases. Narrow or floppy heart valves put extra stress on the heart. This can be through a restricted outlet or incompetence of the valve, so blood leaks backwards. Number 4, medications and drugs. This is a very important cause where chemicals can damage the heart muscle, especially too much alcohol, cocaine, methamphetamines, and unfortunately some types of chemotherapy agents are very toxic to the heart. Number 5, chronic arrhythmias. The main one is uncontrolled atrial fibrillation, which causes a disruption of the heart's usual pacemaking. Number 6, nutritional and hormones. Things like anemia, thyroid disease, obesity, and thiamine deficiency all put stress on the heart. Number 7, unknown. Sometimes the cause of heart failure is classified as unknown when multiple investigations fail to identify any specific underlying factors. How is heart failure diagnosed? In my experience, people with heart failure usually present in 2 major ways. Either the patient is admitted to their local hospital because they are acutely breathless and are then tested for heart failure, or they go to their GP because their symptoms have been getting worse, especially fluid retention, tiredness, and breathlessness. A doctor will normally examine your heart and listen to your lungs, do an ECG to check for heart rhythm problems, and then perform a special blood test called BNP or proBNP. This is a hormone that leaks from your heart muscles when the cells are stretched and is very specific to heart failure. This can also be measured over time to see how well your heart failure is controlled. The only way to formally diagnose the type of heart failure, so reduced or preserved ejection fraction, is to have an echo or echocardiogram, which is an ultrasound of the heart. It is important to have this test because it will determine what type of heart failure you have and therefore the best treatments going forward. What are the treatments for chronic heart failure? Right, I will try to make this as simple as possible for you. And remember that this is just an overview. Specific advice for individuals can be sought from a family doctor or cardiology specialists. As always, the idea behind any treatment is to treat the underlying cause. So if, for example, your heart failure was caused by an overactive thyroid, then sorting out the thyroid will usually settle your heart failure symptoms. Of course, your doctor will guide you on this. There are also some really important general lifestyle tips that I would strongly encourage you to do, which are: lose weight if you are overweight. This reduces the overall strain on your heart. If you are underweight, on the other hand, your doctor may give you nutritional supplements. Stop smoking. This will help any underlying heart disease and help your health in many other ways too. Exercise. I know it may sound counterproductive to put strain on your heart, but exercise in any small way is really good for you. I'd suggest regular low-intensity exercise. Avoid alcohol. I personally recommend to completely eliminate alcohol, but at the very least cut it right back. Alcohol is associated with arrhythmias and has direct toxic effects on our heart muscle. Daily weight. Another very important activity people with heart failure should do is to weigh yourself every morning. This is because you will detect changes in your fluid levels by sudden increases in weight. For example, if you put on 2 kgs or 4 pounds in a day, you have accumulated fluid and may need to adjust your medications. Number 6, control blood sugars if you have diabetes. Next, I'm going to run through the medications available and the evidence behind them. For reduced ejection fraction heart failure, which used to be called systolic heart failure, there are 4 types of medicines that are normally given. Firstly, a diuretic or water tablet such as furosemide. This acts on the kidneys to remove excess fluid and usually makes people feel much better in themselves. It won't change the course of heart failure, but it gives you some control over your symptoms. Secondly, ACE inhibitors are used, which are a type of blood pressure pill that acts on the blood vessels and kidneys. For example, enalapril. Thirdly, beta blockers are given, which reduce the pressure on the heart and slow the heartbeat down. For example, metoprolol. Both beta blockers and ACE inhibitors have the best evidence in prolonging life expectancy and improving illness, but they have their drawbacks in terms of side effects and are not suitable for all cases. Then there is spironolactone. This is a type of diuretic which can help the symptoms of heart failure. Again, one has to be very careful with this medication because it can cause high potassium in the blood and make people susceptible to falling over. I've talked about this in my video on spironolactone. There are newer medications available, such as sacubitril or valsartan, which look promising, but it has its own issues with side effects like dizziness and could possibly increase one's risk of dementia. Unfortunately, for preserved ejection fraction heart failure, which used to be called diastolic heart failure, there is limited evidence for the treatments currently available. It's really about focusing on all the lifestyle measures I mentioned and getting your fluid balance right by using diuretics like furosemide or spironolactone. If the symptoms are very bad, some doctors will advise to restrict fluid intake to between 1.5 to 2 litres a day. Additionally, your doctor will probably want to keep a close eye on your blood pressure and pulse. What is the outlook for heart failure? This is a tricky question to answer as everyone is very different with different underlying medical conditions and different causes of heart failure. Overall, the 5-year survival rate is about 50%, but for those who have reversible causes of heart failure, they should be able to completely recover. Not surprisingly, severe heart failure will have a worse prognosis, while milder heart failure is compatible with a longer life expectancy. Although the prognosis for heart failure may be unnerving, there are numerous lifestyle changes and medications that can help slow down the progression of the condition and increase your chances of survival. I'd recommend to control the factors you can change, including monitoring your weight, exercising, and eating a healthy diet. Please let me know in the comments what you want to learn more about. Thanks for stopping by.